Hello, I'm David Baez, your MSU Extension State Health Specialist, back with you in our series of conversations about COVID-19. As you can see, I'm, have a little bit of a different backdrop. I'm back in my office today. Plan to continue working from home mostly, but I did need to get in today, and I thought I would have this conversation from here. But I want to point out that I did bring my mask with you, and so I encourage you anytime you get out and about to also have your mask and mask up when you're out in public. Since I'm here in my office alone, I did take it off for this conversation. May is Older Americans Month, and so I want to talk a little bit more about that. I have my colleague, Dr. Joe Wilmoth, here with us today. Joe is a gerontologist and a family scientist here at Mississippi State University. He's going to have great insights for us. Thanks for joining us, Joe.
Hey, thanks for inviting me, David.
So, Joe, we're hearing lots about COVID-19 these days and about high-risk populations. Clearly, older adults are one of those populations that are at higher risk for COVID-19 and then for being sicker when they do get it. Can you tell us more about that? What are you hearing in this arena?
Yeah, as you said, we're all real familiar with the fact that it's older adults as well as those who have other underlying health issues that are especially at risk. As we get older, our immune functions tend to decline, which means we're not able to fight off diseases as well. I am particularly, I guess, aware of this as an old man, 69, who's been diagnosed with asthma. That makes me just very much conscious of those kinds of issues. I did note that in Italy, at least, the average age for deaths was like 81 years of age. So it clearly is a disease that especially affects older adults. I'm thinking about a gentleman, an acquaintance I visited with about 2 months ago, had a lengthy conversation about joint interest and so forth. Within a few weeks, he was in ICU with COVID-19. And so someone who seemed to be very healthy was still very susceptible to that. And I know others in a similar kind of situation as well.
There's nothing like having a personal connection to someone who gets sick from COVID-19 to really jolt you and realize just how significant of an impact it can have on someone's life and on the ripple effect on their community. So let's talk about some of the social implications of this for older adults. How's the pandemic uniquely impacting the older adult population?
Yeah, well, I think it's important to recognize, David, that older adults are not all just alike. There's a lot of diversity. On the one hand, you have some older adults who are still very healthy, very active, technologically savvy. You have others who are very frail, both physically and mentally, and are totally at a loss without dealing with technology and so forth, which are really relevant, especially when we try to make connections in this kind of context. But a good bit of recent research really indicates that social isolation is really associated with a variety of emotional and physical kinds of problems, including higher risk of death. And as a result of that, we see in nursing homes are particularly at risk. One of my students just completed an internship in a memory care unit and described how really challenging it was to try to keep the residents healthy and try to help them stay connected with family members. They had one person in the whole staff that really did all the technology with FaceTime and so forth. And so that's, again, depending on a particular situation of an individual, especially those in nursing homes, it's going to be a really challenging time to be connected with people, which is really important for both physical and emotional health.
So the problem is pretty profound. Social isolation, exacerbated loneliness, and then for those who are at home and unable to get out, difficulty accessing groceries, just fear of this disease and so many things. We could spend days talking about the problems, but I want to be a little more solutions oriented. What can we do? Those maybe not in this high risk demographic, what can we do to help?
Okay, wasn't sure you were ready for my answer.
Yeah, please. Sorry.
There are a lot of things. I know just practical things like helping to make sure that groceries may be picked up, just leave them on their front door, groceries, prescriptions, and so forth. I know we've had young people in our church who have volunteered to be available to help out with those, mowing the yard or other kinds of things that individuals can't do to get out. And I think as well, just encouraging older adults to be sure to follow all the precautions with wearing the mask and disinfecting and washing hands and all the kinds of guidelines that are important for everybody or especially valuable for older adults. I think also those who are not at high risk, just to make it a real point to stay in touch. That may be things like writing letters or sending cards or telephone calls, making an effort for things like FaceTime, Zoom meetings. Just a few days ago, my mother-in-law, who had surgery recently, and she's in her second rehab facility, and she doesn't do well with technology, but somebody helped her. And so her 4 children and several of her grandchildren and even some great-grandchildren all got together at the Zoom meeting with my mother-in-law, who's, again, very much isolated. In fact, within the facility, she has a 14-day quarantine isolation from even staff in the facility. Nobody from the family can go in to see her. I know some who have, with family members who are in ICU, have still been able to at least communicate through glass and so forth, as well as through things like FaceTime and telephone calls and so forth.
So, and that's helpful. Thanks for highlighting those things. I want to circle back to something you highlighted a minute ago, and that is that older adults are it's not a monolith. There's a diversity of states of well-being and states of illness and disease among older adults. And so to just paint older adults with one broad stroke is it wouldn't be fair or appropriate for us to do. I want to think for a minute about the resiliency that older adults bring forward with them into older adulthood from their younger adult days. Can you speak to this and maybe reflect on this bigger problem that we've been talking about from an asset-based perspective, or maybe a resiliency framework?
Yeah, I'd be glad to. I think there's several things that go into that. One is that older adults tend to have a positivity bias. They tend to focus more on positive things and tend to be less impacted by negative things, either in the past, their memories, or even things they're currently experiencing. I think beyond that, there is, and related to that, is just having more of a big picture kind of perspective of things. And with that, their own experiences, things they've been through. They've been through Vietnam War, and they've been through all kinds of financial situations and a number of other kinds of epidemics, if not on this scale. And so being able to say, to some extent, been there, done that, we survived, we're going to make it, I think is part of it. And beyond that, older adults tend to also be more likely to be religious. And religiosity also is related to higher levels of resiliency, as well as better health and better relationships and so forth. So I think those things are pretty much unique to older adults, but really are related to their being able to make it in this kind of situation, certainly still needing help and especially being more vulnerable than other populations, but certainly have those kinds of assets, strengths to bring to this situation.
Well, Joe, this has been great. What are the 2 or 3 key messages you'd want to leave with our listeners, our viewers today, to take forward with them?
I think first, to be sure that older adults have the essentials they need, food, prescriptions, those kinds of things. Second, to encourage them to follow the guidelines for being healthy. You probably, like me, have seen some memes about adults who are saying, now roles are reversed, I'm trying to get my parents to not be going out and so forth. And so really emphasizing following those kinds of guidelines. And then finally, just stay in touch. It's isolation is really difficult, loneliness, and so forth. And so stay in touch the best way you can using whatever kinds of technologies or media that you might have.
Well, Joe, again, thank you so much. And thank you, viewers, for joining us today. As Joe just said, be sure to reach out to the older adults around you, check on them, provide whatever kind of help they may need that you're able to appropriately provide during this time, and be generally supportive of them. I know we're all struggling to make it right now, but it's important for us to look on one side to someone who to help us, and then look to the other side to someone we can give help to, and that will help us pull through this difficult time. Again, see what older adults need during this challenging season, and let's be sure to help them pull through. As I always recommend, drop a line in the comments below about what's been meaningful to you in this conversation, what you found interesting, maybe what questions you've got. And always feel free to leave us a suggestion for other topics that we can cover in future conversations about COVID-19. Thanks again for joining us today. And as always, I encourage you to stay vigilant, stay healthy.